Today marks the 61st anniversary of Medicare and Medicaid being signed into law. The 1935 Social Security Act provided the groundwork for a public insurance system. That is Medicaid and Medicare. So let's take a look back at the timeline from 1965 until now. 1965. President LBJ signs Medicaid and Medicare into law, giving health care coverage to most Americans age 65 or older and offering states health care funding for low-income children, caretakers, and people with disabilities. 1967, coverage expands, adding more screening and diagnostic services for all children on Medicaid. 1972, adults under 65 with long-term disabilities or end-stage renal disease become eligible for Medicare. In the early 1980s, Medicare expands to cover hospice and more at-home care. 1986, EMTALA starts requiring hospitals to give emergency care to all patients, regardless of their ability to pay. 1989,
our first obligation is to the most vulnerable, infants, poor mothers, children living in poverty.
Medicaid expands access for pregnant women, children, and infants to address high infant mortality rates and barriers to prenatal care. 1996, group health plans are required to end unfair limits on mental health benefits. 1997.
Because we have acted, millions of children all across this country will be able to get medicine and have their sight and hearing tested and see dentists and doctors for the first time.
CHIP is signed into law and covers uninsured children in families that don't qualify for Medicaid but also can't afford health insurance. 2010, President Obama signed the Affordable Care Act into law, which cut the uninsured rate from 14.4% in 2013 to 9% in 2016. Extended how long children can stay on their parents' insurance, and made it illegal for insurance companies to deny children with pre-existing conditions and more. The ACA was a massive step in helping more Americans access the high-quality, timely care they deserve. 2025, H.R. 1, that Republicans refer to as the Big Beautiful Bill, ended essential ACA premium tax credit extensions. Health insurance premiums are skyrocketing, and many enrollees have reduced eligibility. Up to 200,000 Oregonians could lose their health insurance, and across the country, 300 rural hospitals could be forced to close. Since the enhanced affordable care tax credits have expired, Americans are paying significantly more for their health care premiums and going without health care. My Republican colleagues voted for this to give billionaires tax credits. We're going to keep fighting for quality, affordable, appropriate care. I represent a lot of rural communities who have been devastated by the Republican budget bill, H.R. 1. So we're going to fight to get back to where Americans can afford to access health care, and health care debt is no longer the #1 reason for bankruptcies in the United States.